according to me, the most important thing in anatomy is the imagination. So with the help of certain diagrams and a 3D model, we'll try to imagine and then learn the relations of the kidney. So starting with the interior relations. So as we know, the kidneys lie in the retroperitoneum, in the posterior part. So most of the contents of the abdomen are the interior relations of the kidney, and the posterior relations are made by the posterior abdominal wall. So first of all, looking at the interior relations of the right kidney, as you can see, this structure is the kidney. This is the right kidney. So what we can see is this is the liver, and then this is the colon. This is the ascending colon, and this is right colic flexure, and then this is transverse colon. So basically, whole this part is the colon. And then this is the duodenum, and here lies the small intestine, the simplified version of the small intestine. So as we can see, all these things lie anterior to the right kidney. So using this, we can see, like, from the back, as well as I rotate it, we can see almost nothing else is lying in front of the right kidney. And yes, as I remove the liver, we can also see the this adrenal gland is lying at the upper pole of the kidney. So this also makes the interior relation of the right kidney. Okay, so now we'll draw the interior relations of the right kidney. So let's say this is the right kidney. Okay, so we saw that the adrenal cortex was lying in the superior part. So this is the adrenal cortex. Okay, then what we saw was the liver was lying. Okay, so this is the this is the hepatic area. Let me color it. Okay, with orange, let me color it. This is the hepatic area, and below the liver, what was lying? The colon. Okay, so let me color. Below liver, colon was lying. So this is the colic area, and then below the colon, a little bit more, I think. Okay. Now below the colon, the small intestine. Inside the colon, a small intestine was lying. Okay, so let's say this here lies in the small intestine. Okay, small intestine, and preferably we can say jejunum was lying, and at the hilum was lying the duodenum. Mainly the D2 portion of the duodenum was lying. So all these make the interior relations of the kidney. Okay, now we'll see the posterior relations of the right kidney. No, firstly we'll look at the anterior relations of the left kidney. Okay, so as you can see, this hair which is lying behind is the left kidney. Let me show you. This is the left kidney. Okay, so and what you can, from here the parts are visible. What all is lying in front of the left kidney is, this is the stomach, this is the pancreas, which is also behind the stomach, This is again the colon, and this is the spleen. So all these four parts primarily, and here the small intestine lies. All these parts primarily make the anterior relations of the left kidney. Okay, let me show you again. This is the stomach. This is the pancreas. This is the colon, and this is the spleen. And inside the large intestine, here in the smaller portion, there will lie the small intestine, preferably the jejunum. Okay, so now we'll draw the relations of the left kidney. Let me show you. Now, this is the left kidney, and yes, I forgot, in the superior part adrenal gland will also lie. Okay, so this is the left kidney, and in the superior part again there will lie the adrenal gland. Then in front we saw that like this, something like this. In front we saw that stomach was there. This was, let's say, the stomach, and a portion of pancreas was also like देखो in the above portion, like you can see in the above portion there was only stomach. And since pancreas is behind the stomach only, so pancreas is lying a little bit below, and a little bit below, but also behind the stomach. So there is a pancreas a little bit below. Okay, so pancreas is like something like this. Okay, pancreas lies here. And then this portion in the side. In the side, as you can see, it was made by the spleen. So this portion was the spleen. Okay, this is spleen. And below the pancreas lies the colon. So here, like something like this. This is our colon. And then in the inner portion, here lies the jejunum. Okay, so this has become a little bit chaotic. Let me color it properly. This is the gastric area, then this is the pancreatic area. Let me mark it for you all. These are the suprarenal glands. Sorry. Then firstly we again revise the anterior relations of the right kidney. This was the suprarenal gland, then this was the liver, then below the liver there was colon, then below the colon, inside the colon basically, there lies the small intestine, primarily the jejunum, and at the hilum lies the duodenum. Okay, and then we come to the left kidney. For the left kidney, this was the spleen, this was the adrenal gland, then this was the gastric area where lies the stomach. Okay, this was pancreas, which was also again present behind the stomach. This was the colon, and inside the colon lied the jejunum, the small intestine. So these were the anterior relations. Anterior relations of kidney. Okay. Now we'll see the posterior relations of the kidney. Posterior relations of both the right kidney and the left kidney are almost the same, except there is only a difference of the rib, the 11th rib. As you know that the right kidney is a little bit lower than the left kidney because of the liver present on the right side. That liver pushes the right kidney a bit down. So what happens is that since it has been pushed down, it does not lie in front of the 11th rib. It lies in front of the 12th rib, but not in front of the 11th rib. Whereas since the left kidney is a little bit higher up, it lies behind both the right and the it lies in front of both 11th and the 12th rib. Let me show you if I can. So like this, they have not given the 11th rib here, but this is the 12th rib. Okay, and the 11th rib, this is the left side, this is the right side, and this is the 12th rib, and the 11th rib lies here. Okay, 11th rib lies above the 12th rib, and you can see that the left kidney is a little bit higher up, and the right kidney is a little bit at the lower level because of the liver. There is only this difference. Okay, and also the diaphragm lies above in the superior portion. Let me see if I can show you the diaphragm. Here, look, this is the diaphragm. Okay, this is the diaphragm. Now diaphragm makes the posterior relation of both the kidneys, and this is a quadratus lumborum muscle, which is also a posterior relation, and this is the psoas major muscle on both the sides. Let me color these for you. I'll color them with blue. These. These, what I have colored with blue, are the psoas major muscles. Okay, these are psoas major muscles, and these ones are the quadratus lumborum muscles. Okay, which mainly form the posterior relations of the kidneys. Okay, as you can see, the psoas major muscle lies medially, and quadratus lumborum lies more laterally. So when we'll draw the relations of the posterior relations, we'll draw the psoas major muscle more medially and quadratus lumborum more laterally. And transverse abdominis muscle also makes the posterior relation. It lies again even more laterally, even lateral to the quadratus lumborum muscle, like here. Okay, on both the sides here it lies. Okay, so what else can I show you here? rest the nerves and the vascular bundle is present in the posterior part of the kidney, which are not given here. So I'll just draw them. Okay. Now we'll draw the relations, the posterior relations. Okay. Um, Firstly, we'll draw the posterior relations of the right kidney. From the posterior side, the right kidney, since it will turn, it will look something. It will be like a mirror image of the left kidney from the front. So it will look like this. Okay, I'll draw both the kidneys. Okay, this one is the right kidney and this one is the left kidney. So firstly we'll draw the diaphragm. So diaphragm, okay, I'll draw with pink highlighter. It is like this. In all this part, lies the diaphragm. Okay, and what I have drawn, these are the median and lateral arcuate ligaments of the diaphragm. Okay, this one is the medial arcuate ligament, and these ones on the sides, these are the lateral arcuate ligament. This one again is the lateral arcuate ligament. Then from beneath the diaphragm passes the subcostal vessels and the nerve. Firstly we'll draw the muscles. Okay, as we saw, like this, and then this, this, and then this. For a separation, I'll highlight only the middle one, the quadratus lumborum. Okay. Look. Now, as we saw, the medialmost muscle was the psoas major. Then lateral to the psoas major was the quadratus lumborum. Then on the lateral most was the transversus abdominis. Again, this one is the transversus abdominis. Okay, so this is the diaphragm, the medial arcuate ligament, the lateral arcuate ligament, and then the muscles from medial side to the lateral side is the psoas major, then quadratus lumborum, then transversus abdominis. Okay, so after these we'll draw the the vascular bundle, neurovascular bundle. Okay, I don't have the red pen, so I'll draw it with the orange, and for the nerve I'll use the green pen. Okay, so in the right kidney, below the lateral arcuate ligament passes like this, like this, and like this. These are subcostal vessels and the nerve. Okay, subcostal vessels and the nerve. From here as well, like this. From beneath the lateral arcuate ligament, like this. Okay, this is, let me mark it. These are the subcostal vessels and nerve. And then passes two more nerves, the iliohypogastric nerve and the ilioinguinal nerve. These will pass, like this is iliohypogastric, and this is ilioinguinal. Okay, this one is the this one is the ilioinguinal. Okay, so these are the nerves here. This one is the iliohypogastric and this one is the ilioinguinal nerve. Iliohypogastric, and this one is the ilioinguinal. Okay. So, and yes, I forgot the ribs. For the ribs, okay, this one. Since this is the right kidney, and I have told you that the right kidney is a little bit lower, so this there lies only the 12th rib. Okay, this one is the 12th rib. Okay, and similarly here there will be the 12th rib, and also there will be the 11th rib here, like this. This one is 12th and this one is the 11th rib. Okay, so these are the posterior relations of the kidney. So let me show like this. These are the posterior relations of the kidney, and with this, okay, these like this. These are the anterior relations of the kidney. Okay,